Good afternoon, everyone, and welcome to my Friday message. My special guest this week is Dr. Beverly Gray, Associate Professor of Obstetrics and Gynecology. Dr. Gray is a vocal advocate for reproductive rights and women's health here in North Carolina and across the nation. Today we'll talk about the recent legislative measures to restrict abortion rights and about her efforts to educate legislators and ensure the best care for patients. But before we talk to Dr. Gray, I'd like to share a few updates. Today marks the beginning of National Physician Assistant Week, and that gives us an opportunity to recognize our exceptional PA program, which is a pioneer in the true sense of the word. The PA profession was born at Duke, when the first educational program for PAs was created and established here by Dr. Eugene Stead in 1965. In the decades since, Duke's PA program has remained atop the profession, perennially ranked the best in the country. Thanks in a large measure to Dr. Stead and the exceptional faculty, staff, and students in our PA program, physician assistants now play an indispensable role in healthcare nationally and around the world. October is also National Physical Therapy Month, an opportunity to celebrate yet another of our exceptional health professions education programs. Our program incorporates an innovative curriculum, clinical internships, and global health experiences, and like our PA program, is consistently ranked among the nation's best. Congratulations to both our PA program and our physical therapy communities, not only this week and this month, but throughout the year. In research news, Duke scientists report that an antibiotic that has shown effectiveness for bacterial pneumonia also appears successful in fighting methicillin-resistant staph infections. If approved by the FDA, ceftobiprole could provide a new line of defense against a common and often deadly bacterial infection. No new treatment has been approved for use against this strain of staph in more than 15 years. Despite focused effort, staph infections still have a 25% mortality rate at 90 days. Congratulations to Dr. Akankshi Munjal and Samira Musah for being named recipients of NIH New Innovator Awards. These grants are awarded through the NIH Common Fund's high-risk, high-reward research program. They support unusually innovative research from early career investigators who are within 10 years of their final degree or clinical residency. Dr. Munjal is an assistant professor of cell biology whose research focuses on the principles of tissue morphogenesis. Dr. Musah is an assistant professor in biomedical engineering, nephrology, and cell biology. She studies how molecular signals and biophysical forces guide organ development and physiology. And I want to call your attention to an important event coming up, the Symposium on Emerging Infectious Diseases. This event is a collaboration between Duke NUS Medical School's Infectious Disease Program and the Duke Center for Virology. It will feature a wide-ranging series of discussions over 2 days, October 24th and 25th, at the Karsh Alumni and Visitors Center. Please visit the address on your screen for more information and registration. And now, please sit on my conversation with Dr. Beverly Gray. So Dr. Gray, thank you for joining me today. I have been such an admirer of your advocacy for reproductive rights. So tell us how you got into that.
So I've been involved in advocacy sort of late throughout my career. The work that we do in family planning is advocacy in and of itself, I think. Providing care that is sometimes controversial. But when the Dobbs decision happened, it was really important to be more out there and having a voice where otherwise there might be a vacuum if there's no voice of reason and a voice from the medical community. So we had started our advocacy group about a year before the Dobbs decision happened. So we had been meeting regularly, getting to know our state and federal leaders or lobbyists here at Duke, and already having conversations with legislators, so we were already making those relationships. And then Dobbs happened and we went into higher gear, luckily with the support of the institution, which has been wonderful.
So you do have a lot of challenges right now, both locally and nationally. Talk a little bit about what that looks like.
Yeah, so locally in North Carolina, SB 20 went into effect July 1st, and that's a 12-week abortion ban with some exceptions. And there are a ton of administrative burdens with this law. So patients have to come in person 72 hours before to receive some state-mandated counseling, which one of our residents recently described as incredibly patronizing to patients, to make them second guess their decision or give them information that may not even be necessary for their situation. So that's a requirement. There's a ton of paperwork now that has to be signed. There are new reports that have to be submitted, and none of it is medically necessary. So it's just creating administrative burdens for clinicians, for clinics, just to make it harder to provide this care.
And many states are dealing with similar changes.
Yeah, and it's different, state to state, month to month. So South Carolina just recently enacted a 6-week ban. Their Supreme Court reversed their decision in their state, and now they have a 6-week ban in place. And so, just keeping up with what different states are doing is, a full-time job pretty much. And then for people living in North Carolina, they often aren't aware of what the state laws are until they need the care. And then they're, just surprised at how much they have to go through. So
you mentioned when we started that you're going to participate on your board for OBGYN. This must be part of the conversation.
Yeah, so as a complex family planner, we talk about kind of what's necessary for our fellows to have in their training. And, if a fellow is training in North Carolina, how will we be able to make sure that they have the necessary skills? How will we be able to make sure our residents have the necessary skills to be able to safely take care of patients?
So you recently wrote and had accepted a perspective in New England Journal. Tell us a little bit about that.
So last year I reached out to our bioethics colleagues here at Duke. I was interested in auditing a class, so I audited their intro master's bioethics course last spring. And I was interested in that because I wanted to be able to frame what I was seeing in front of me in a bioethics, with a bioethics lens. Because much of the laws that are being placed are unethical. A lot of these burdens are completely unethical, and this idea of creating exceptions or someone being able to say, which exceptions are acceptable, I found that to be incredibly problematic. So throughout my, the semester, I was able to write this piece and really kind of frame it around our experience here in North Carolina. We do have a law with exceptions, but exceptions always leave out important patients. And we're just heartbroken for all of those patients who are left out and who are unable to have care. Because we know when patients are turned away that there's risk to their life, their health, their financial, trajectory, their life trajectory.
Yeah, an important perspective. So obviously a lot of work to be done. What are you prioritizing as kind of your next steps?
So we're prioritizing how to train our residents, how to get them the necessary training here, how to maintain the rights that we have and start to get back some of those rights here in North Carolina. I don't think this is the end of the story. I think it's important that people are aware and are registering to vote, understand what their legislators care about, because we could be looking at a 6-week ban if we're not proactive. And so we have to keep fighting to maintain what we have, but also to get back those necessary rights for people.
Well, we are so appreciative of the work that you're doing. I know it is not easy, but so important. Thank you.
Thank you.
And thanks to everybody else, and have a great weekend.